Hi, my name is Hüsamettin Uslu and I'm working as a fertility specialist in Istanbul Brüksel IVF Center. As preimplantation genetic technologies are increasingly used with in vitro fertilization treatments, today I'm going to talk to you about these tests in terms of definition, methods, and whether it's the right choice for your fertility treatment or not. Preimplantation genetic testing comprises a group of genetic assays used to evaluate embryos before transfer to the uterus. There are several definitions. Preimplantation genetic testing for aneuploidy is a broader test that screens for abnormalities in all chromosomes, including 22 pairs and sex chromosomes, for example, Down's syndrome or Turner's syndrome. Preimplantation genetic testing for monogenic diseases is used to test a specific genetic mutation associated with a known diagnosis or known predisposition within a family, like sickle cell anemia, Fragile X, or maybe thalassemia. Preimplantation genetic testing for structural rearrangements also enables us to check translocations, which are also an evident cause of miscarriages. The main question is, do all infertile women need preimplantation genetic testing for aneuploidy? Well, for the time being, there is insufficient evidence to recommend the routine use of these tests in all infertile women. However, in women with advanced age, recurrent implantation failures despite morphologically good quality embryo transfers, recurrent miscarriages, prior history of genetically abnormal miscarriages or deliveries, or known genetic problems within the family, maybe offer the preimplantation genetic testing in order to increase live birth rates and decrease early pregnancy failure rates. Okay, how do we perform preimplantation genetic testing? Does it harm the embryo? With the newest technologies and experienced lab staff, embryos actually are not affected. A group of cells surrounding blastocyst, which is a 5th or 6th day embryo, are biopsied and analyzed. Therefore, since the inner cell mass inside the embryo, which ultimately forms the fetus, stays intact, embryos are not affected. But since these outer cells may not always reflect the genetic constitution of the inner cells, sometimes mosaicism and false positive or false negative results may limit the studies. Therefore, each patient should be informed regarding the benefits and limitations of the preimplantation genetic testing procedures, and treatments should be individualized. Thank you very much.